Maayong adlaw kaninyong tanan. We are pleased to present the Purok Kalusugan Northern Mindanao model. Guided by the DOH Health Sector Strategy with focus on attaining better health outcomes and to ensure bawat Pilipino ay ramdam ang kalusugan. The CHD Northern Mindanao PK model was built on strong CHD-LGU collaboration. Our primary strategy was active case finding through house-to-house visits with patient referrals to barangay health stations. Survey data analysis provided a clearer health picture per Purok, enabling evidence-based decisions. The implementation began with a cascading of PK within the CHD, followed by a series of FGDs and identification and engagement of the pilot LGU and barangays. PK was piloted in the city of Cagayan de Oro in the barangays of Bayanga, Carmen, Gusa, and Makabalan. The PK Working Committee was organized. They developed the operational guidelines, data collection tools, and the PK dashboard. The PK tool contained key questions to assess the health of each family member. A region-wide inventory of Purok officials and functionality of barangay health stations was conducted. Once ready, the City Health Office, barangay captains, and BHW presidents were engaged and oriented on PK, while the DOH HRH, CHO, BHS health workers, and BHWs received in-depth training on data collection tools. Led by the SIDOHO, PK teams and deployment plans were formed for each barangay. The PK teams conducted a household assessment under the close supervision of the DMO5 in coordination with the CHO-BHW coordinator. Led by the DOH HRH, BHWs conducted house-to-house visits for assessments. The collected data were verified by BHS healthcare workers and encoded by HRH staff and CHO data encoders. The household assessment was conducted and completed from October 1 to 15, 2024. After verification and encoding, the data were uploaded to the PK dashboard. Post-implementation, mobilization allowance was provided to the PK teams. A PAR was conducted by the SIDOHO and data analysis was done by the CHD surveillance unit. In total, the PK team surveyed 25,770 households in 15 days, covering majority of the target households in the pilot barangays. The Northern Mindanao PK dashboard provides visualized and granular health data on the priority health outcomes at the level of the barangays and puroks for all life stages from infants, children, adolescents, adults, to the elderly. It features the spot map and demographic data of the assessed households, trend of household assessment coverage from October 1 to 15, data on child and adolescent health including FIC, vitamin A supplementation, deworming, and HPV vaccine, data on adult health including PNCU, folic acid or MMS, family planning, TB, HIV, cancer, and PhilPen, and data on the water source and sanitation facilities. The success of this pilot stemmed from deep diving with the community leaders, ensuring their full support to the program. This led to resource sharing with the LGU shouldering the reproduction of PK forms, designation of CHO staff as encoders, and transportation for some BHWs. The gains from the house-to-house visits were maximized by providing health education and promotion, and using collected data for decision-making and increasing consulta registration. To share some testimonies from the BHWs, may iba na ayaw magpa-interview kasi nakakapagod. Busy sila. Akala nila ayuda, baka gamitin daw sa scam. Merong gated households na ayaw dahil sa data privacy law. May renters na pag binalikan namin, wala na sila. Natuwa ang mga constituents namin sa area dahil naihatid namin at na-inform sila sa mga serbisyo na nais ipaabot ng Purok Kalusugan. Maganda ang Purok Kalusugan para sa kapwa natin dahil nalalaman ng DOH ang mga needs nila. Tapos para sa lahat ang Purok Kalusugan, kasama ang senior citizens, bata at adolescent. Bilang BHW, handa kaming magsakripisyo at ibahagi ang aming talento at oras para sa aming kapwa. Moving forward, as we continue to tackle poor health outcomes through Purok Kalusugan by improving service delivery and augmenting manpower and logistics at the local level, we must be cognizant of the reality that sustainable health development lies in improving the health systems at the barangays and puroks through better health governance. As such, for 2025, the main Purok Kalusugan strategies of CHD Northern Mindanao will be the implementation of the Barangay Health Leadership Management Program, strengthening the BHW registration and accreditation committees, establishing the PCPN, and maximizing PhilHealth Consulta registration and first patient encounter. Purok Kalusugan is a tall order indeed, but we believe that kayang-kaya basta't sama-sama.